So I will let kind of just each of the therapists from Steady Hope introduce themselves, and then we'll let the gals from Kemper introduce themselves and kind of tell you a little bit about who they are, just personally and professionally, and then we'll jump in to just kind of answering some questions about the postpartum season, give some tips and practical like advice and wisdom for the postpartum period. Sam?
Yeah, my name is Sam Merrill. I'm a mental health therapist here with Steady Hope. I'm a mom myself of a little one, so have had my own postpartum journey with pelvic floor therapy and with therapy. So have a passion of working with mamas, like Kim said, like specialize in perinatal mental health. And yeah, I love this work.
Thanks, Sam. And I don't think I said this, but as I was talking, my name is Kim, and I am the founder and director here at Steady Hope, but I'm also a licensed professional counselor, mama of two kiddos that are 4 and 2, and have had just my own experience of working with a village of providers as a mom, and saw a couple of pelvic health PTs, my own therapist, and just some of the other resources that we're going to talk about. And I think through my own experiences and my own journey of kind of postpartum period, I really found myself working more and more with perinatal clients. And just also, I think as I've gotten older into the field of counseling and the longer I've worked with clients, just continued to find that pregnancy, postpartum, infertility, kind of all of that was just a common topic that was coming up regularly. And so that's who I am.
My name is
And
Bridget. Thank you so much to Kim and everyone at Steady Hope for being interested in doing such an important collaboration. So I am one of the pelvic health PTs at Kemper Pelvic Physiotherapy. I am also a childbirth educator and a doula as well. And so what I really, really enjoy treating in pelvic health, all the things like within our clinic, we say we kind of specialize in complex chronic pelvic pain. So we see a lot of folks that maybe feel like they haven't been able to find relief in other ways or going down other avenues. And we really work from a whole body approach to help improve people's quality of life. As I really got into the scope of pelvic health, the group that really just stole my heart was perinatal group. So I really like working with pregnant and postpartum folks. A lot of my passions came from learning about maternal morbidity and mortality, learning about how it disproportionately affects Black women. I am from the city of Atlanta, Georgia. My family are immigrants. All of it speaks really close to my heart. And originally, I wanted to do this work outside of the United States, but once I learned about all the things going on within our own soil, I just felt really impassioned to do that. Coming into Kemper, I was able to join some other therapists that have a lot of the same passions. Along with the perinatal group, I really enjoy working with people that have like chronic pelvic pain conditions like endometriosis, maybe some hormonal issues like PCOS. And then also people with bowel issues. I'm a yogi myself, so I really enjoy working with yogis as well to help them through any of their pain that they're experiencing. So that's just a little bit of a tidbit of what we do in pelvic PT. So I'll let Megan go ahead and introduce herself as well.
Megan Beach-Gomes. I also work at Kemper Pelvic Physio. Bridget really hit the nail on the head in terms of what we can treat within the pregnancy and postpartum period, and that's a huge passion of mine. I also treat chronic pelvic pain, pretty much anything that runs the gamut within the pelvis. That is what I treat. I also really enjoy now starting to treat more runners, especially because that can be one of the only sports new parents can really do. It's super accessible. You can go right outside your home and do it. And so being able to do that symptom free, so that includes no pain, no prolapse sensation, and no leakage, all of the things you might feel when you're a fresh new parent. And along with that, and then anyone who just wants to return to sport, love getting to you to do and be as active as possible.
Yes. So I am Brenley, Wiley, and I am a licensed marriage and family therapist. And yeah, I am really passionate about this population and received training through Postpartum International for perinatal mood disorders. And my passion for this population really just was born out of a lot of my clients getting pregnant at once. And it was just kind of a funny the way that it happened, and just been a really cool journey, just learning more about this. And I was kind of new to the whole world of physical therapy and pelvic physical therapy. In the last few years, I feel like I really learned more about it. And so really excited to just learn more and be able to connect my clients and just be equipped with more information. And yeah, I am also a therapist at Steady Hope. So I work with Sam and Kim. So, yeah.
Thank you guys so much just for sharing a little bit about yourselves and just joining us live tonight. This is kind of workshop 1 that we're hoping to kind of host a series and be able to focus in on pregnancy and postpartum season. Kemper PT was an organization that we got introduced to last summer, and it has just been fantastic to get to know Megan and Bridget and partner with them. And so we're just excited tonight to share just a little bit of kind of some tools and resources about pelvic health PT and taking care of just your physical health as a postpartum mom, and then a little bit of some resources around mental health for this postpartum season as well. And so I'll just even ask Bridget and Megan just a little bit of like, say I was a brand new postpartum mom, why would I come see you guys? Like, what are some of the things that you can help with? And I mean, what would it be like for me to come see you for an appointment? And do I have to wait until a certain point after I've had my baby?
All right, this is a fun loaded question here. So multi-part answer. So first and foremost, lots of people think they have to wait until they have an injury or they don't feel very good in order to come to physical therapy. And that's not the case. And it's also not the case that you have to wait until your doctor refers you. Every state in the United States is what's called direct access. So you can actually refer yourself to PT, and then we can send a message to your doctor to update them what's going on. But you do not have to wait on someone else. You can check right in. Bridget and I are both proponents that anyone who's pregnant should come and get PT. And that's not necessarily to wait till you're postpartum, but postpartum is a great time to start, just because of how many changes your body goes through during pregnancy. This is not a zero-sum equation. You know, once the baby's out, you do not go right back to where you started from. There are changes that you gradually happen, and then you give birth, and there's quite a sudden flux in how you're probably feeling. When you're pregnant, your posture changes. We tend to get more open and exposed towards the front. Everything kind of pinches towards the back. Your breathing changes. Your ribs open up and widen to accommodate the size of your baby. But that can make it feel almost still challenging to breathe even postpartum. You might come in and feel like everything just feels weird. Maybe it's hard to connect with your abs and your core. Those are some basic things that even if it feels like, oh, there's nothing really wrong, that's just postpartum, still a good reason to come in. With that being said, some things you might notice are more symptoms. Can be leakage. That is probably the biggest thing we see postpartum. So urinary incontinence. That can be either vaginal delivery or C-section, although they have kind of 2 different reasons why that might be happening. And then scar care is another one, and that can be, again, C-section. That's pretty obvious scar, but if there's any perineal tearing during the delivery, that's a great reason to come in to make sure that that scar does not stay painful and increases mobility. And then the biggest one is just, let's get back to feeling strong and feeling more like you. Yeah, I don't know if you want to add to that, Bridget.
Yeah, that was a great answer, Megan. And I kind of just want to touch on some of the things that are really important to highlight, because people understand physical therapy a lot in terms of, I got injured, so I'm going to go see a PT, or I have this tweak and I need to go see a PT. And a big part of what we want the perinatal population to know, and this is geared towards postpartum, but this is how we help our folks in the postpartum as well too, is even if you're thinking that this might be something that you want to do, why not go ahead and start coming to PT so you can prepare for it? And what we see anecdotally and in the evidence is that if someone comes, the earlier they come in pregnancy, the better opportunities they have to either recover or not have as many of those issues that we can see in the postpartum. So the earlier you come, the better. And so also just understanding as well that when you become pregnant, this is a whole new phase of life, right? And you have to relearn how to connect to this new body and this new person and this new phase of life. And that's not an easy thing to do on your own. And so just having someone there that can be a support system throughout the process and even afterwards. I like to harp on a lot the fact that we as PTs, we're really lucky that we get to see people all the time. I think mental health therapists get this ability as well. We are professionals that get to see folks on a regular basis, and therefore we do really get to know and understand everything about what's contributing to why they are experiencing what they're experiencing in front of you. So we use that to our advantage as much as we can. And so, yeah, I think that as pelvic PTs, we know just how vital it is to be able to educate someone on how to connect with their body before, during, and after this entire journey of pregnancy. And we'll probably touch on this, but I think all of us can agree here, once you're postpartum forever. So that there's no time period on when someone can come in to see us after having a baby.
Yeah, I'm so glad you said that, Bridget. I think the misconception so often, especially for postpartum, is that once you have that 6-week appointment, you're all good and you're no longer postpartum and all the symptoms are going to go away. Or that once your baby is a year old, that all good and all the symptoms are going to go away. And so I love that you just highlighted like there is no kind of wrong time frame to come in. And I mean, I think you guys, I love that you shared too that there's so much benefit of coming in during pregnancy to kind of even prepare yourself and to learn some tools and get ready for that postpartum season. I think pelvic health PT, even for me, like preparing for a second birth was so beneficial to come in during pregnancy to learn a little bit more of some strategies of, okay, I know how first birth went. How can I prepare for this now? And what can I be thinking about kind of postpartum? And so for you guys, like if a postpartum mom is coming in early on, or you're working with a pregnant client leading up to that postpartum season, are there any of your like favorite exercises or suggestions or resources that you guys like to teach or share?
Oh yeah, absolutely. We have a whole gamut here. So I'll start with some of the things. I think one of my favorite pieces of education to give folks before they have their baby are the products to have in the postpartum or before the postpartum period. So they're there and ready. So I'm going to go through some of those right now. So we talk a lot about bowel health. A lot of people don't realize we can help with that. We can help people work through any type of bowel issues along any spectrum, whether it's constipation all the way to diarrhea. When it comes to pregnancy, constipation tends to be what is experienced more often. And then for anyone here who's had a child, we know how scary that first postpartum poop is. And so we give a lot of education on using a squatty potty. So that's getting a stool in the bathroom, which helps to improve our toileting posture. When we get our knees above our hips, it helps to relax some pelvic floor muscles, and it actually improves the emptying angle for your rectum. So imagine that you have a pelvic floor muscle wrapped around, here's your rectum here, and then you get your knees above your hips. That muscle gets released a little bit. You worked on your breathing so much, so you know how to poop really well. And now your rectum,
Oh,
yes, Megan is showing us something.
here.
I think you have to unblur your screen so you can see that.
Yes.
Yes, that is the perfect visual. So you can see what happens when you get those knees above your hips. That's more of a 180-degree angle. So it is much easier for anything to come out of a straight angle rather than a kink. So the squatty potty is essential. Combined with that is a stool softener. So we have folks start taking it a few weeks before their due date, so their poops are already starting to be softer. If we can make this as least painful as possible, that's exactly what we're going for. So bowel stuff is a big one. Peri bottles and padsicles. So things to really help with that perineum care afterwards. So if we have a vaginal birth, even if we don't, right? Like we know the pelvic floor, when we're thinking about anatomy and how it's that bowl shaped underneath us, its main job to support our organs. So that's our bowels, our bladder, and our uterus, if we have a uterus. So that has been put on stress, right, the entire time throughout pregnancy, growing, supporting life, all the things. So even if you have a C-section, perineum care is important, but especially if you have that vaginal birth, especially if you've experienced some tearing, then you want to be able to take care of yourself without irritating it. So the bottle will help you keep that area clean without having to wipe and cause friction where there may be some stitches. And then those padsicles, ice, like it's just icing, right? Like it's some basic things that we don't think about that we can utilize to really, really help us manage some of these symptoms. Those are some big things. Megan, do you have some other ones that you want to talk about?
Not products per se,
Mhm.
but Kim, you kind of touched on the fact that like 6 weeks tends to be this magic number that I think a lot of our folks are like, 6 weeks, I get cleared for exercise, so that must mean I'm healed. When that's really not the case. We do need 6 weeks to get clear for anything because that's usually the time it takes for your uterus to heal, but that's really all 6 weeks is indicative of. Research has actually shown that it takes closer to 6 months, even a year, for tissue to return to that sort of pre-pregnancy stage. And so with that, 6 weeks is like a bit of an obsolete number in that we can start exercising right away. And I say this because I don't want people to go out and start running right away. But you can start connecting with your core, doing some deep breath work, actually doing some gentle Kegels. And I say this gently because you don't want to swing in the other direction and have just complete tension there. Mostly just connecting with where your body is in space. As I mentioned earlier, like everything really changes. Like your body is just kind of wacky in terms of how it feels. And so just being able to fire up your abs, fire up your pelvic floor. What does, your posture look like? Those are all great things to do week one. We do have other, more strenuous exercises. Strenuous, again, being kind of key. It's really more like a gentle squat, maybe a modified plank, but just small things that you can do right away. You don't have to wait for 6 weeks and then just, hit the ground running there. Actually, this leads me to a question for y'all though, because again, 6 weeks is not a magical number, and postpartum is quite the marathon. So I was wondering how you guys can really prep that new parent for the mental load of that really lengthy postpartum recovery, especially if maybe someone doesn't expect that timeline to happen.
Do you want to start? Okay. I mean, I think like you guys said it, I really do. I think what can be really amazing for us as mental health therapists working with this population is if we're already working with a client when they're pregnant. And so then the runway of kind of even beginning to prepare for postpartum for that first year and beyond, we can start that work when a client is already pregnant. And so several clients have been having babies recently on my caseload, and so just leading up to them having those babies, we are able to hold space and talk about all the emotions leading up to that birth and kind of what they're anticipating, what they're expecting. We can provide the psychoeducation around the differences between baby blues and anxiety and depression postpartum. We can hit on that and share a little bit more information about that later. But I think one of the big things that our team really loves to walk clients through preparing for postpartum, but this can be done even postpartum. And so maybe we have a client that comes in at 6 weeks or at 12 weeks, and they're a new postpartum mom, and they are looking for just some initial kind of resources of how do I even like begin to kind of make sense of this season. We love to share a postpartum care plan with them and kind of start to work through questions to think about holistically all facets of themselves of what are some things that they can do to care for their physical well-being, what are some things that they can do for their mental well-being, who else can they bring into their village? Are there lactation consultants or postpartum doulas, or could a friend help start a meal train? Could they even create a list of to-do tasks that need to be done around the house, and perhaps ask some of the kind people dropping off food to help with some of the tasks on the to-do list, or even a spouse. Or I know for us postpartum, like in my own personal experience, we had the opportunity where my parents came for a period of time, and I think it was really helpful to be able to give them or just ask for some specific things to really be able to care for ourselves in that season. And that helped, and that can help lead to just even a little bit more permission, quote unquote, for the mom or the dad to go take a nap during baby's nap time, when baby is especially sleepy at the beginning, to just be able to choose rest instead of running around the house and trying to pick up everything or go to the grocery store or do those tasks. And so I think even one of the big things we love to talk with postpartum and pregnant clients leading up to the postpartum season is just thinking about what are the small tasks that they could do each day that helps them feel a little bit more like themselves. And so brainstorming with them before they get to that season, or when they're in the midst of that season, of just some things that might help them feel like themselves, because I think that can be a common experience that we see is especially newly postpartum parents just feeling like their life revolves around diapers and feeding and sleeping and all of that, and they can feel really disconnected from themselves, which then ultimately ends up playing into mental health. And so I think just coming up with kind of basic suggestions or basic things that a client might do to care for themselves, like getting dressed each day, or taking a shower, or getting kind of ready for the day, or choosing to go on an outing when they feel like up for getting out and going for a walk or moving, being able to, I think this is where a pelvic health PT can be so helpful, is being able to help coach them on how far to start walking at each point of that early postpartum journey. Of maybe you're getting to the end of the driveway at the very beginning, but you're still getting outside and you're feeling the sunshine, and you're not feeling quite as like nap trapped by the darkness in your house. I think some of the other things are, if you love to read or you love to connect with friends, could there be some creative ways that you do that during that postpartum season, like inviting a friend to come over for coffee, or when the baby is sleeping, or getting up and reading a book for a little while? And so those are a couple things that come to my mind.
Yeah, and I think I would just say too, like, you don't know what you don't know until you go through it. I know with even my own experience, my first pregnancy, it was all about the baby or like the birth experience. And honestly, no one really talked to me about like what it would be like. And everyone's postpartum experience is different. Even if you've had multiple babies, like each one can be different. And so, and even if you've been through it before, again, like it's kind of easy to forget like what those early days are like. Even that first year, like you go through so many changes, like at the very beginning, but then as babies, 3 months old and 6 months old, like sleep schedules and routines and getting back to work. And so I think, yeah, therapy can just be a helpful space to take that time for yourself and just like take a look at like, how am I doing? And have someone like hold that space for you and ask you like, how are you doing? Like what are your thoughts like? What are your emotions like? Like, have you taken time to like breathe and just like settle for today? I would say too, again, like you don't know what you don't know. And so even with perinatal like mood disorders, I think a lot of moms suffer in silence because they think, oh, this is normal, or this is, just my lot as a mom. And a lot of times that's not true. I mean, from what we know statistically, almost 1 in 5 moms have a perinatal mood disorder. And to say it's common doesn't mean that it has to be normal. So I think to have someone, be able to help you see like, okay, what maybe is normal, and help you feel like you're not alone, you're not isolated. I love when I'm able to sit with a mom and just ask her like, well, what do you think your neighbor feels? Like, do you think your neighbor who has a baby has felt that way? And it's like this light bulb goes off of like, yeah, I guess I haven't thought about it like they probably feel that too. But then also as a therapist, helping them see like, okay, these are maybe symptoms of something deeper going on that can be treated. Like we can get you relief. You don't have to continue going with these anxious thoughts or these like feelings of depression or whatever it might be, the intrusive thoughts. So yeah, again, like you don't know what you don't know. So to have someone really kind of hold your hand and walk with you through that season and just be like checking in on you, I think is really helpful.
Yeah.
Yeah. Going off what you said earlier, I also tell all my postpartum folks, if you can just do one thing for your body every day, like that is such a win. And I will send them, I mean, I'm realistic. I ask them on their first eval, like, what is a realistic amount of time you can spend doing an exercise program? Some folks are like, I'm good for 45 minutes. Some folks are like, I'm good for 5. And that is what we're going to tailor your home program to. That is no shame if you can only fit 5 minutes in. Like, I want those 5 minutes to be like the best 5 minutes here for your body. But even if that's just like you're going to lie down in bed and you're going to do some breath work and you're just going to feel where your breath goes, you're going to do one stretch in your bed. That's fine as long as you're doing something to help your body feel better, because it's hard to feel good in your mind if like your home is not feeling good. So I really do think just being able to move your body is going to just help with the mental aspect too, and also just give you something to progress forward into.
Yeah, I mean, you couldn't have said it any better, Megan. I think, and this is why I think we all work so well in conjunction with each other. I think we really understand that connection between the brain, your nervous system, your body, mental health. And I think for us, whenever someone comes into our room, sometimes we have to really educate on just kind of that entire picture, because a lot of people aren't putting together all the things that are impacting their ability to be the best version of what they think is for themselves. And a lot of people want to be that way as a new parent. And they're not realizing there are so many things or practices that we've gone so far away from. And this also speaks to my other soapbox when we talked about isolation a little bit ago. Part of what I think contributes to this period being so difficult, especially in our society, is because we're so isolated. And historically, and in other societies, that's not how people have children, because it is very hard to do something on your own. One, if you've never done it before, and two, if you don't have any support system or village around you to help you. So I feel like a lot of what I'm hearing already for our postpartum people is if we can prepare and develop who and what that's going to be before we get there, it's probably the best thing that we can do for ourselves. In that same vein, it's never too late. And so a lot of times some people feel like, oh, well, I'm 6 months in now, like what can be done? And it's like, there's literally so much, so much that can be done. Liz, I'm sure you understand this as like a childbirth educator and doula, but a big part of what you want to do is prepare folks for not only labor and delivery, but for afterwards as well. And it's about like making sure you have all your X's and O's covered so that you're not thinking about it during this time when your hormones are still out of whack. You're literally only responsible for keeping this baby alive, which is what your body is doing. Like that's what your body and brain are doing. It's only working to keep your baby alive, especially at the very beginning. It's tough to figure out all these things when you're in that state. And so I think preparation is key for all of this, definitely.
Yeah, absolutely. I love that you highlighted too that it's never too late to seek mental health therapy or pelvic health therapy. And that actually, I think even at like different points in your postpartum experience, there's going to be different things that you're going to be able to focus on and care for your body, care for your mind, in different ways.
Definitely. So I want to know something from you all. What do you think is the most common either mood disorder or emotion you tend to see from your moms who are coming in and sitting in front of you?
Yeah, I would say anxiety is probably the biggest one. I think PPD, postpartum depression, it it really is a thing and it's out there. But I think I see more moms dealing with anxiety in that early postpartum period. But also I would say, like, you can develop a perinatal mood disorder up to a year postpartum, and most people don't know that. So even if in those early stages, like with the newborn, like you are doing well, like 6 months in, it could hit you. I think the anxiety is the big piece, the worry. Like we as humans are wired, I think, especially as mothers, like if we've birthed a baby, our nervous systems are gonna be like hyper focused on the survival of that baby anyways. And it's supposed to be that way. We're supposed to look at, are they breathing? Like pay attention to every little detail. Our brains physiologically change during pregnancy and in postpartum to be able to think about many different things at once. And so that is all natural. But I think where we kind of get off course is, again, with the anxiety, maybe like the intrusive thoughts, like the constant worry, like I can't turn my brain off, I'm so overwhelmed. That's what I work with moms on a lot, is one, like what is the root of those anxious thoughts? Like, again, like, is it a survival thing, or like maybe have you gotten off track somewhere? And then what are the coping tools that you can use? In a way, we all cope in one way or another. Just some of those ways are not as helpful as others. And so yeah, I think for a mom, it's like, okay, how can we stabilize you to where like you're not feeling like you're crazy, like you can't turn your brain off? Let's like get your nervous system to a point of rest, to where you can feel calm. And then maybe like once you're stabilized there, let's do the deeper work. Because often I see too that anxiety is rooted in things of our past, or just ways that we've been wired like from a young age to be hyper attuned to certain things. So yeah, that's what I would say, is I feel like anxiety is not really talked about as much.
Yeah, absolutely. I would agree with you. I think so often many moms are coming in and presenting with anxiety. And I think even what you were talking about too, I think one of the go-to coping strategies so often for postpartum moms, especially in the season, is to search for more information. And so often, especially I have moms that are coming in and they're up at 2 a.m. and they are searching for more information to try to figure out, why is my baby crying right now? Or how can I make my baby go to sleep easily? And I think just too, the reality of today's day and age is there's so much information that it's so overwhelming. Like I know it, especially even in my first postpartum experience, we were trying, I think, 3 different sleep strategies at one point in time, because, why try one, try 3. And I remember my mom sitting my husband and I down very, very kindly at 6 weeks and was like, guys, you guys are doing great, but why don't you just pick one and just try that? And it really, I mean, thankfully we could receive that in that moment. But I think I see that so often with my clients, especially clients that even pre-pregnancy or pre-postpartum season would say that they are more wired towards perfectionism or wanting to do things right or to do things well. I see a lot of postpartum moms and pregnant moms, and partners that are already thinking as soon as their baby gets here what their baby's going to be like when they get to 20, and wanting to start reading the parenting books ahead of time. And so I would say that's a common topic. The intrusive thoughts. Another one that we see in the counseling room at times is postpartum rage. And I think the hard thing with postpartum rage is similar to anxiety, there's just a lot of shame around experiencing that symptom. And I mean, truly, even as you look into the research around postpartum rage, it's so natural. It actually like comes from being overwhelmed and being stressed, which is, I mean, exactly what a lot of the like postpartum season is, especially at the beginning. And that postpartum rage can oftentimes feel pretty scary because you find yourself more angry at your partner or at your baby, or there may be some times where those intrusive thoughts might come in and they actually can feel like kind of scary thoughts towards either yourself or someone else. And so we work and support birthing partners and parents through that experience as well. But I think, like Sam said, like oftentimes too, postpartum depression, we see a lot of postpartum clients that come in with birth trauma. So they wanted to maybe have birth go one way, and it either didn't go the way that they had anticipated it going, or something during that birth experience um, just kind of started to go awry, or there was a heartbeat that the doctors were concerned about. And maybe, I think pretty typically I hear stories of just kind of suddenly a swarm of physicians and doctors and providers coming into the room, and then things just happening pretty quickly, and parents feeling really disconnected from the birth experience and what just happened in that moment, and why did things move as swiftly as they did in a direction they weren't anticipating.
Yeah, I think a lot of perfectionism and shame can like exacerbate that trauma too. Because we kind of have the birth goals. We don't like to have just a plan because how often does the birth actually go according to plan? So rarely. Um, but a lot of times folks will go in thinking this is like exactly what I want, and then when it's very different, even if it's not necessarily injury or anything, like if it's different, it's can be traumatic. Now add on to the fact if there is a birth injury, maybe you went in thinking you're gonna have a vaginal delivery and you had to have an emergency section. That can be really, really scary. And then also, I think that perfectionism aspect can be really hard if you're not recovering how you expect to. Again, that 6 week period is like it's all in the media. Bouncing back after pregnancy is all in the media, and just makes that postpartum period so hard when again things aren't going how you expect it because how we expect it is not realistic. It really isn't. We just need to give ourselves so much more grace within our bodies and just like mental aspect wise too. Um, we try to really reinforce that too, and the patients we see, no matter where you are, you're probably doing fine. And there is a way that you can always recover after that potentially traumatic birth. We also like to treat in more trauma informed way. You know, in that way, we always expect some type of trauma to have happened to our clients who came in, and then we make sure that no matter what we do in the assessment, they're okay with it. We have so many different layers of what we can do. I think some folks maybe actually don't seek out pelvic floor physical therapy because they're really worried it's going to be invasive. When that's not the case, we can say all external, we can say all closed on. There's still a lot of changes that you can make in your own body without anything hands-on too. But it can almost be like healing, not just physically in that way. You can really take control of how your body's feeling and transfer that to the mental aspect too.
Yeah, like I think thinking about what Megan was saying and Sam, what you were saying about how we can try to combat the anxiety that people may feel. Sometimes that top down approach might not be the first way to go, right? It's really hard for us to get through mentally. So we can start on the physical side of things. And once again, it's just emphasizing how much our professions really work well together because we can approach from that angle. And then there are times, just like Megan is saying, we're all very, very in tune with trauma informed care. It's the way we have to approach pelvic health therapy because just as we've been talking about, there's so much that we all store within our bodies. And I know, at least from my experience and what we've seen, even with research, it's starting in the core or in your pelvic floor. One of my favorite little educational pieces to tell people is that they've done studies on the first muscle group that is going to react to trauma. And trauma can be like the door slams, right? Or I'm watching a scary movie and I get scared, or it can be actual physical trauma to yourself, mental, emotional. Anyways, all of that, it's your pelvic floor that's going to engage first. And so now let's translate this into the birth space. We could have a whole talk about birth trauma in the hospital room. So I'll save from going off on a tangent from that. But imagine going into something with an expectation. um, I'm also very big on a lot of what we experience are societal norms of the way that we should be approaching things and what we should experience. And we have to break down a lot of things that people just learn from a young age. It should be this way. And so, as birthing people, as people going into spaces that like things to be a certain way, it's very hard to come to terms with the fact that, just like Megan was saying, birth cannot be planned as much as you want it to be. So then imagine going into that space and then your body is no longer your own, whether it is any of those reasons that happen. And now you're coming into the postpartum period where you have to care for this child that you just birthed and you took. I mean, it's been a whole year process, basically, right? Of this baby coming to the world. And now you don't even have the mental space to deal with a trauma that you just experienced happening physically to you in a setting where you're supposed to be cared for and have professionals looking out for you. And sometimes starting with coming back into our body is where we have to start. Sometimes mental health is where we have to start too. And so I think we have gotten pretty good at parsing that out. There are some folks that we can't do much except breathe. Like we can't do a lot. We can't come close to putting our hands on them. We got to talk through a lot of things. They've got to read some stuff. They've got to go get talk therapy because our bodies hold on to so much. So I think it's important to understand too that there are approaches of how we can address some of these things, whether we start from the top down, bottom up, or come together from the start. They're all really effective ways. You just have to be really good at tuning into what your patient needs. So this all just emphasizes for me more and more why pelvic PTs and mental health therapists are such important parts of a village for a birthing person, for sure.
Absolutely.
Mhm.
I think even just one practical question is like for a postpartum mom that has a baby at home with them, how do you guys work with a postpartum mom that has a baby that's at home with them now? Or can they bring their baby to session?
Yeah, they can. We love when babies visit. It's like actually our highlight. Um, Especially if we saw someone throughout their pregnancy, we're like, oh, we already know this baby. We're always really excited when they come in. Um, yeah, anyways, I get excited for a baby talk. But again, I always just tailor it to like, do you feel like this is going to be your 5 minutes a day and then you just sneak it in? There are things I do. I'm like, hey, do you have time to do 30 seconds? This is what you're going to do after you brush your teeth. This is how you're going to do it on the countertop. Um, is it something that, okay, your baby is going to be your weight for this exercise? Like if that baby is 6 months out and they have some good like neck control, like your baby can be your weight and it's fun for them. It's playtime. You get a little actual exercise in. Some of mine are floor exercises. So like if that baby is doing tummy time, you are going to be doing your floor exercise next to them. It's really guided so that it is achievable and you can do it with your family.
Yeah.
It shouldn't feel like it's tedious.
Yeah, I love that. I mean, we really love when babies come in. Like we try so hard to tell people, please bring your babies in. It is not a burden. It's honestly very helpful, right? Because a lot of the aches and pains that people are experiencing have to do with taking care of their baby. So let me see how you're doing this. Let me see you pick up your baby. Let me see you hold your baby and all the 10,000 other things. Moms all of a sudden get like 20 arms right after you have a baby, right? So you can carry everything in the world. And it's a lot of these everyday movements, repetitive movements that are contributing to what you're feeling. So if baby can come in, we can actually practice live things, show you how to make changes functionally, whether it's moving, whether it's lifting, pulling, pushing. There's a lot of things we can do. So we really love when the kids come in.
I'll
Absolutely.
also say,
Yeah, go ahead, Megan.
if the patient does not want to bring in their baby, no shame. Because some folks come in, they're like, "This is my me time."
Huh?
Great.
Yes.
This is
Yes.
your me time.
Absolutely.
Yeah, your baby does not need to join you to still get benefit from it.
Yeah, I think
Exactly.
that's the same thing for us in mental health therapy is like baby is welcome to join either virtually or online. Baby is also welcome to take a nap or have somebody else watch them for you to either come in person to the session and maybe put real clothes on and go get a coffee on your way home from a therapy session. Or when you're at home and you are jumping on for a session. And then also babies are welcome for you to feed them during a session if you need to. And I think that's what I love too about just pelvic health PT that I don't think many women know about pelvic health PT is that there are just like so many practical tools. And when you bring your baby into therapy, that you guys are able to help coach us and them on of how you're carrying that car seat that weighs so much. And then you're carrying all the diaper bags and everything else, and your body's like contorted. And or you're feeding your baby all day and you can't figure out why your shoulders and your back are just on fire. And I mean, obviously there's so many reasons for that. And I just love too that pelvic health PT, like you guys mentioned, it's like self-care. It's caring for your body and beginning to reconnect and just remember the fact that you've been pregnant for like basically a year and that it's going to take time, like grace and time and space and rest and slowing down are like some of my favorite things to talk about with postpartum moms is like, let's just have more grace and like space for ourselves and for each other.
Oh yeah, absolutely. And when it comes to the physical side of things, the amount of patients that I've had that just feel so much relief when I tell them you should not expect to feel the way that you felt, even 3 months after, 6 months after. So much of this is hormonally related. And we already know your hormones have been doing a lot of stuff throughout all of this time, and they're trying to find their way back to normalcy. And that is impacted by if you're breastfeeding or not, if you're producing milk. So that's like one of the biggest piece of information I give moms too is that if you're breastfeeding, this may set your timeline back a little bit in terms of feeling like yourself, coming back to yourself, your hormones coming back to the levels that they were before, because your body is still very much like, oh my gosh, you have this baby here that your body is made to keep them alive and to feed them. And expectations and having that knowledge does so much for people. I think we all know this. We're all educators within our field, and knowledge is so powerful. So when I tell people, like, I mean, minimum 3 months if you're not breastfeeding, and then if you are, you're going to kick that up until after you're done. And so depending on how long that is, just knowing those things can help someone kind of release some of those like false expectations that shouldn't be there anyways. It's just people telling you things that haven't experienced this stuff before or want to act like it's only rainbows and butterflies. And there's a lot of beautiful things about the process, but obviously there's a lot of realistic and some heavier things that happen as well. And so this is such a great opportunity for us to be talking about that, so people know that it's okay to have postpartum rage, to have postpartum anxiety, that it makes sense that this is happening in the society that we live in, that we shouldn't, like if we were an athlete, I feel like our athletes are the hardest ones in the postpartum to let them know, like, you're still going to be strong, but it's going to take a little bit of time to get back to where you were. And you did something amazing and you are different from what you were before, but it doesn't mean that that's bad. And I think that's a big thing too, like body image and having people understand, like, you did something so incredible to create a life and to now continue to sustain a life, that your body should be different and it should change. And there should be signs of this. Now we just have to come into like a space of acceptance.
Yeah. Yeah. And I'd say, I mean, with your emotional life and your identity as well, right? Like when you become a mom, there really is no going back to who you were before, but that can be a beautiful thing. But also, it takes time to adjust to that. And even in every season, like, what does it look like to be a mom in this season? I like to use parts work a lot with my clients. So just this concept that we are each like individually made up of different parts that make up the whole. And when we become moms, this mom part like comes out. And at certain seasons, certain times, like that mom part really takes over and is a big part of us, as it should be, because in certain seasons, like that is what our attention is going to be on, right? Is mothering. But also, like, I love helping clients remember, like, that still is just a part of you.
Yeah.
That's not all of you. But how now can, like, all of your parts, like, learn how to work together now that you have this new identity, now that you have this new shift in role and responsibilities, like the way that you relate to your friends, your coworkers, your family, like, that all shifts and changes. And just like you said, Bridget, like, to expect us to, overnight, like when you birth a baby, become a mother, like, that's a whole process in itself of learning who you are now as a mom.
Mhm. Yeah, absolutely. I think what Sam is even speaking to is so often what we're talking with our clients that come in and they're processing mom guilt, which is so normal. But the reality is like, as Sam said, like there's a part of us, the mama part, but then there are also all of these other parts of ourselves. And so I think it can be so hard to create the space to remember that there are lots of parts of you and that you can give yourself the permission to kind of take off mom hat at times and just be able to care for like all parts of you and relearn what it looks like to feel like yourself in this new season and like you guys even mentioned to even begin to really get to know this new body and how your body can get strong and feel good after having a baby because I think especially our parents generation so much just identified with like well after you have a baby like everything is just loose and you just pee yourself and that's just how life is and so I think education like you guys have all spoken to is just so key to be able to help everyone learn and recognize that we don't have to just settle for things because it's normal. So, anything else, Bridget or Megan?
No, that was great. I think that was a great way to wrap it up. Yeah, I think just we have so much connection. Mental health therapists are like the number one people we refer out to, and it's
Absolutely.
just the connection that we can have with each other.
Same. We absolutely love knowing pelvic health PTs and being able to refer back and forth and just provide that education of who are pelvic health PTs, what do they do, how can they support you, and so many different facets and parts of your life. And so thank you guys just for being willing to partner to host a workshop to talk about postpartum mental and physical well-being. And thank you, Liz and Megan and Brenley for jumping on with us live and hope you guys have a great night.
Bye, everyone.